when we're trying to think about our health condition, we immediately, before we come to the ER, we go to Dr. Google and immediately, like, how many of you checked your symptoms in Google this year?
I do.
Only 2 of you?
All the time.
So probably both of you already made a farewell letter and thought you're going to pass away or something like that. So in our new year, we're trying to do something different, and that's the pioneer to things that we want to do in the whole hospital. We want to reduce the level of the uncertainty of patients. We want to reduce anxiety. We want to empower our patients because they're very smart. They know to do things, the patients, and if they're unable, we can give their family members to help them. So when you will come to our new ER that's about to be the biggest one in the Middle East, it will be 3 floors of ER. It will open in 1 month from now. When you try to navigate yourself, you will find out that we have small robots that can help you navigate in the hospital. It's not that photo, it's not our robot, but it will have something similar. You will see something like you order a food delivery and you check every second where is your delivery guy. You can check where is your turn in the queue and who is the next doctor you're going to see. And you will be your own manager of your journey. You can feel like you're going to the airport. When you come to the airport, you do a face recognition, you check your passport, you do all the check-in by yourself. You could do it here. We'll have a new booths that you can do face recognition. You can eventually you can put in all your documents and get immediately a smart bracelet that can locate you and help you move all your steps in the ER. And also, you will have a stand of a self-checker that you can check your temperature, your blood pressure, your heart rate, and all the things that you have to wait for hours and hours for the nurse or someone that can finally see you to do. And another thing that I spoke about, we are trying to reduce anxiety, and we're trying to look for different solutions, and we found already one to implement in our ER but also around the hospital. So we found a very, very cool solution that's called MindSpa, actually from Europe, and it's something that patients can go in and relax themselves because there are a lot of time that they have to wait, and then they get the anxiety, and also their family members. So this specifically, it's a 3D for hearing that's really relaxing and really cool. And okay, I'll move forward because I don't have enough time, but I want to, I have much more things to say, but I will share it in another situation. So we in Ichilov and in hospitals, we want to be our patients' trusted advisor in their healthcare, in their everyday health. Not only when they come to our ER or to see the doctor, but we have a big problem with that because we have in Israel 4 different insurers that they are the trusted advisor of patients. But we want to try to still give the added value for that and try to keep the connection with our patients. So the way that we are doing it is, first of all, we built communities. We built 2 big communities, and we'll take it more furthermore. One is in the wellness industry. The second one is the whole journey of birth. It's something that we have, like when you're thinking about having a child, before you have a child, while you're having, and after that to the woman and her husband or partner. And other things that we're doing is we built small companies, sub-companies to Ichilov. The first one is Ichilov Home, is to give medicine and help until the house of the patient, and that helps us do the continuity of the care. Another thing is Ichilov Web. It's something new that I'm telling it for the first time today, but we are building a one-stop shop system for therapists. So every therapist, not only from Ichilov, but in all Israel, all around, can log into our system and give telemedicine, CRM, all what he needs in one place, and also people from all over Israel, from places that are much weak in their knowledge, and doctors can use our knowledge of people around here. And with Ichilov Tech, we're building very interesting solutions for chronic diseases, again, to empower our patients. We don't want the disease to manage the patient, we want the patient to manage the disease. And here we're doing different... Yeah, sure.
So this is very interesting, all these different innovations, but something we are struggling with, I think all of us in our hospitals, and I'm wondering what your thoughts were about it. How do you kind of connect that into one logical patient journey, or behind the scenes in one logical infrastructure, or technical infrastructure or application infrastructure?
So I think it's a very, very interesting question. I think that in healthcare, like in other places, you don't have only one patient journey. You have many patient journeys, and you need to do find different personas that you wanna give the patient journey to, and also even in one patient journey like the ER, we have many different journeys, because you have people that come with the...
Let me then rephrase.
Yeah.
I'm in Fogma. I don't want 75 different digital apps on my phone. So
we have 0 apps.
Integrate that.
Yeah.
Or whatever.
So
is it connected?
Yeah. So first of all, the patient journey is something that you see on the outside, but our system and infrastructure is something that we are building in the inside, and that will help giving our different patient journeys, and also our therapists, that they have also their journeys. So we are building different systems, like technological systems that we're trying to do hybrid, like half cloud-based and half not. But we have like a platform of the omni-channel that patients all over can approach us from WhatsApp, from Instagram, from wherever they want. We have, and also on the other side, we're managing one patient. We can see his whole interactions with Ichilov.
Even if it's in a new operating room, or if it's...
Definitely, yeah. That's an omni-channel system. It's something that you have many companies that does it. So we have that. We have the CRM that manage the patients. We have different systems that we are building. I can speak with you and explain it afterwards. We're implementing an RPA system that it's a robotic of different processes that will help aggregate different systems, but I can help you and answer it later.
Do you do that with external companies, or do you build that internally? I mean, who are your partners in this journey?
So another great question. In the hospital, we don't have a huge budget, as I think you all know. So our computer division is a tiny one. They cannot really develop by themselves something. So we use many different partners. Some of them are the big tech companies like Microsoft, Amazon, as I mentioned, and other. We are very lucky to live here in Israel. That it's like an innovation hub. So different initiatives, different startups and solutions that we connect and build things with. And another companies are like the medication companies that we together are trying to build different journeys for chronic patients that they're interested about and we're interested about. And one of the things that we're building is an MS solution for patients with MS. Another one is for kids with diabetes, how they're managing their whole journey. So there we are building different apps for your questions, but we want to build those apps like it's powered by Ichilov, but to give it to patients all over Israel, because our mission is to really move the health care system here forward and not keep everything here.
Can you share the results of that? I mean, do you have equity? Do you have equity in these companies?
So that's something I think Sprech and Omer will speak about. Okay, 1 second. So I want just to touch something, last thing, because you took all my time. It's not fair. So you asked, I don't know what's your name, but you asked about the different systems that we have here. So we have also the patient journey, but we have also our therapist journey. So what do they think about all the system, all the data that we have around it? It's very cool, but they need to use the HR, imaging system, clinical system, administration system, CRM. They have whole tons of data, and by the way, they need to take care of patients. They need their patient not to die. Yeah, so they are dealing with data overload or too much information, and what we're trying to build is also like trying to take all this data and make it a real treasure for the therapists, like the patients. And we want to build, one of the things that we're building is taking all of these different systems and putting them into one place for the therapists. So I want them to get notification if blood results come back. I don't want them to refresh their computer every second. I want to do an aggregation of all the systems, that they will have a one-stop shop of everything they need. I want them to have a decision support tool and develop with the guy from the data unit that was here different AI tools of maybe different medication that's relevant, or to consult with other experts in Israel and out. I want to educate the doctor during the time that he does it, and eventually to control his patients. And not only our therapists, and with that, I promise you I'm done. Not only the therapists face different information flooding, we have our sanitors, or people that are transporters, that they're one of the main forces here in Ichilov and in any hospital, that they need to move patients from place to place. So until 1 year ago, in 2021, we had one person sit in front of a computer screen. On one side, he has all the calls from different departments in all this huge hospital. In the next one, he has all the transporters that are available, and he needs to know where they are, which tool they need, where they need to get to, what is their physical condition, if he can take that or not. And then we wonder why patients are not satisfied on the time, and also the transporters. So what we did is we did a hackathon together with Ichilov Tech, and we bring different needs here in the hospital. One of them was this need, and we came out with a really nice solution. I'm sorry about the Hebrew, I just took it in the last moment, but a nice solution that it's like a Get Taxi or any taxi, sorry? Uber, yeah. Like an Uber app for the transporters, that it's very easy for them to use, and it reduced 13,383 hours of patient waiting in the whole of the hospital per year. And it's something amazing that we're only starting, and we're making it even better. And for the transporters, instead of walking, they used to walk about, I think it was 14 kilometers a day, and they're not athletes like myself. And we had to, we were able to reduce it and to make it much more efficient. So I need to finish, but last thing that I want to ask you, do you know what that means? Come on, you must know. All these super brains. So I'm finishing with that. It's a NASA thing that's be greater than average. So do every day something that you can be better than average. And I'm really excited for you having me. You can connect me to LinkedIn through the QR, and thank you very much.